If I may, I'll now move on to Dr. Richard Roope. Richard, you're here to talk to us about where the prostate actually is and what to expect when someone goes to see their GP with a potential prostate issue.
Thanks for the intro, Lou. It's great to be with you and a real privilege to be able to join such a great team. So what is the prostate gland and where is the prostate gland? Well, the prostate gland lies immediately below the bladder. It's about the size of a walnut in a young man. And as we all grow a bit older, it does enlarge with age. The urethra, the proper anatomical term, or the P-pipe, goes right through the middle of the prostate gland. So it's almost a bit like a ring donut, and the P-pipe goes straight through the middle. And this explains some of the symptoms that you get when the prostate gland starts to enlarge. When it enlarges, it can grow inwards, which can reduce the diameter of the P-pipe. So that means that when you wee, the flow is generally a bit slower and takes longer for you to empty your bladder, and sometimes it can stop-start a little bit. In addition, if the prostate gland is growing upwards, it then puts pressure on what's called the neck of the bladder, and that can make you want to wee more often, and particularly that's noticeable through the nighttime. In terms of the functions of the prostate gland, it's basically tied in with sexual function. So it produces some of the fluids that the sperm are then able to swim in. It also adjusts the alkalinity of the fluid so that it can then counteract the fluid within the female reproductive tract. And so it's all tied in with that. It also has some role to play in the sensation that a man feels during sexual intercourse. And also the gland has some hormone function, producing some of the hormones also associated with sexual function. So that's basically the prostate gland, where it is and what it does. It would be great if we had a prostate cancer specific antigen, but as yet we don't have one. The researchers are trying to do lots of clever things to find if there are alternative ways of detecting prostate cancer, which would make life a whole lot easier. In terms of what to expect when you come to see us, your GP, or increasingly now, your first contact may well be by an e-consult or a telephone call or a video call. The first thing that will happen is the GP or one of their nursing colleagues or one of the other clinicians will run through your symptoms, also obviously your heritage background and whether you've got any family history, particularly whether there's been a prostate problem with your father, or if you have any brothers, whether they've had a similar problem. And then depending on the circumstances, they may arrange a blood test first and then bring you in to examine you, or they may ask you to come straight into the examination and then arrange the blood test after that. So that's roughly what to expect. The examination, depending on what's gone before, may involve pulse and blood pressure, as we quite often do, but then may also involve an abdominal examination. And just occasionally, if it's required, we may have to check out the prostate gland, which is actually done through the back passage. So that's what to expect. And depending on the findings, your GP or the nurse or the paramedic practitioner would then arrange for that blood test, or if necessary, an onward referral to our urology colleagues in the hospital.
We're going to hear now from Duke, who has kindly joined us today.
Hello, everyone. Hi, Lou. Thank you very much. So yeah, well, growing up, I heard about prostate cancer for a number of years. And when my dad and my mum are from the Caribbean, a lot of the time when you mention prostate cancer and the DRE, the digital rectal exam, there was lots and lots of homophobia around it. So the message I was getting was, like, do not go to, I am going to get a prostate exam because of the rectal exam. So I grew up believing that for a number of years. And during that time, even going to doctor's surgeries, there was nothing on the walls or any magazines to say, basically, Duke, as a black man, you should be going to get checked, because a lot of the campaigns were done with people outside of my colour. So I didn't really resonate to that. So it wasn't until my dad, who's just recently back from Jamaica, who has now has prostate cancer over the last 5 years, told me about it. And he was always telling me, you should go and get checked, you should go and get checked. I spoke to my mum, I spoke to my daughter, you should go and get checked. And it wasn't until I came along onto the Dorset Race Equality group alongside the Wessex Cancer Alliance group and speaking to some of the specialists within those groups. And they mentioned the PSA. And I thought, well, what's a PSA? Because in my head, when you say prostate cancer, I just automatically think of digital rectal exam, which would stop me from going. So they explained what the PSA was, simple blood test. I thought, okay, I'm going to give that a go. So I made an appointment for a PSA, went to see my GP, was down there I probably spent more time in the waiting room than the actual blood test, which was done in like 5 minutes. And I think my count was -1. So there was no traces of any prostate cancer. And I thought to myself, if I'd known this information a long time ago, I would have passed this information on to a lot of my friends and said, you know what, it's so easy. Just go and get it checked. So yeah, if you're out there and you're like me, please go and get it done. There's nothing scary about it. If you've had your blood test done before, it's just very simple. 5 minutes of your life.
Now, Hugh, you've been through the treatment process and you are a prostate cancer survivor. So please, can you tell us your experience?
Thank you, Lou. Thank you for the introduction. It is indeed a pleasure to be part of this very special event. As mentioned, I am a prostate cancer survivor. And because of that, I too would like to emphasize the importance of having oneself checked at the very earliest of opportunities and following that process through, because it could save your life. Although I was monitored since 1999 and followed regularly, it still came as a shock to me when I was diagnosed with prostate cancer. I remember the consultant said to us, my wife was with me, Hugh, you now have a new diagnosis, prostate cancer. Blew me down. I was shocked. I was stunned. I couldn't believe my ears. And the thoughts that was running through my head were, am I going to die? How much time have I got left? Has it been caught in time? And is it treatable? My consultant, who had obviously been used to situations like this, was very reassuring. He was very supportive. And I can say that by the time I left that meeting, that consultation, we were armed with all the necessary information to help us make the decision about what's my best option, as you heard earlier. And with the help of the consultant and the clinical team, it was felt that my best option was the radical prostatectomy, which was done by keyhole surgery 2 months later in April 2014. On the morning of the surgery, I was seen yet again by the consultant and also the anesthetist, who came by and checked that all was well to proceed. And next thing I knew, I woke up in recovery with a catheter, a drain, and a bag. Next thing I knew, I was back on the ward and I was encouraged to drink plenty of fluid to flush things through. The consultant came by that evening, I remembered, and he came to let me know that things went well. The surgery was okay and there was no need for any further concern. I remember my post-op care was very good, it was excellent. And I recall the nurse came out to see me at home to check that all was well. I don't remember having much pain, but I did have some discomfort, which I took Panadol for. And about 3 weeks after surgery, the catheter and the bag was removed. And I recall that when that was removed, I had to show that I could pass urine naturally before I was allowed home. I would like to say that right now I feel as healthy as anything. My PSA, 8 years on, remains undetectable. Undetectable. I do not take any medicine of any type, and I do my PSA only once a year. So that is the situation for me right now. My saving grace, I believe, is that I followed the process. When I noticed that I had some signs and symptoms, I saw the doctor. I got myself into the system, as I would call it, which led to my early diagnosis and my prompt surgical treatment. So like others have already said, the advice would be to get yourself checked as early as is possible and follow the process. Early intervention is the key, and that would lead to a healthier outcome. Thank you for listening.